So I'm delighted to be here with you today. I've been really inspired by everyone I've heard so far today. It is very hot in the room, I know, so I'm not the only one sweating as we begin. So I work with the NSPCC, which is the oldest children's charity in the UK. Our primary aim is to end abuse and neglect. So we are working from a position of preventing maltreatment. And I suppose that's why it's slightly different today. It doesn't mean that we don't do complementary work to the rest of the organisations that are here today. And the piece I'm going to talk to you about today was quite a new step for us to do. We're traditionally known for our sexual abuse work, for our lobbying work, for our policy work in schools. And I head up a campaigns team. We're called the Local Campaigns Team. And we're based in 6 regions in England and 3 devolved nations. And you might know I'm from Northern Ireland, but I manage the team jointly across the UK. So we're a team that's based to really be at that ground level, to work with our national colleagues, to really interpret, inform, help develop responses around child protection and maltreatment that are based with our communities. We're an old organisation. We have been doing national campaigns for many, many years, many decades. And our team was formed around 15 years ago, and we're getting bigger and bigger, which is great. And we now have up to, let's say, 18 staff across the UK doing what we do. We generally come from backgrounds which are not just campaigning. We're not campaigners as in communications. We mainly come from community development background, working in youth, working with refugee groups and families and communities. And that's our approach. So I'm here to talk very briefly today about Look, Say, Sing, Play. And I'm not going to dwell, I was talking to Sal before today, we're going to talk about the new developments and how we've brought it on from where it started. So have any of you heard of Look, Say, Sing, Play? Right, that's great, that's a start. So it's a new development for NSPCC because of what we were doing before. The early years sector, the school readiness sector, the child development sector, the first 1,000 days, you all know inside out. We knew about it too, but we weren't really in that space. And we wanted to support that work, that we could do something with our name, with our sort of size of organisation, that we could come into that area and support other agencies who are doing similar work. But ours was certainly from the perspective of looking at increasing the attachment and the bond between parents, with the ultimate aim of preventing children having to come into services and for families to be experiencing distress. Like yourselves, early intervention is key to it. So Look, Say, Sing, Play. Not the easiest thing to say sometimes, but I'm going to talk to you a bit about how we developed it. So we worked with an organisation, with a research group, and we made sure that they had the same values as we had, to do social research. We didn't want to do the research ourselves, because one of the questions we asked was, do you think a campaign like this would work around attachment and bonding? What do you understand about attachment and bonding? And we spoke to 2,000 parents across the UK. I led on the research with Lot 2, which was what describe as diverse communities, what I call the normal community I work with. And we also had then national research that went out through the other fields that they would do around normal market research. So we talked to parents and we asked them, what did they understand about attachment around bonding? And if we were to do a campaign like this, who they thought that agency was working on behalf. And most of them thought it was actually the Department of Health or health visiting, which we weren't. So again, we could see that the work was there. And I say we were doing it also because we knew the numbers of not 2 3s on the Child Protection Register. We were doing it because of the increasing numbers of young children that we were seeing in that position, and babies. So what did we find when we did that 2,000 interviews, focus groups? We did some work with professionals. We did all sorts of things. They did video diaries for us to document that. We spent quite a bit of money and time to get this right, because it isn't easily done. And we were lucky enough to be allocated that money to do that within campaigns. So in terms of a public health approach, this was a campaign. It's not a service. It's not a programme. But it is agile enough to be woven into the programmes you're delivering. It's agile enough to be wrapped around what you're doing. And as I always say, I don't think it will do any harm. There'll be no harm done in using the content in the hands of skilled professionals or parents looking at it themselves. So what we found is with parents were already interacting with their babies. They were already engaging. They were doing lots of things we talk about. We based this on the child at Harvard, the serve and return metaphor. But even before that, we were talking about their interactions and on the understanding of attachment and bonding. They themselves recognised they were doing some of it, but they felt they could be doing more, and it could be more purposeful and more intentional with more impact. They also identified that most of them were spoken to about attachment and bonding, but they didn't really understand in the real world what would that mean day to day. How did they do it? Some more so than others. And they didn't really understand why it was so important. And when we talked to them a bit about brain development, just realising I talk very fast, so is everybody okay with that? Yeah, okay. Bit late now, said you, for the first 5 minutes. So we talked to them about brain development, and they thought it was important. They thought it was something that would engage them. They thought it was something that would make them think about doing more of this, but they thought it didn't really matter between 0 and 8 months. Until the baby could sit up and coo and sing and point and do, it was nice to do, lovely to do, but wasn't really doing anything. But they also wanted a strength-based approach. They didn't want a campaign that was preachy. They didn't want it sterile. They wanted to see families like themselves. They didn't want to see an IKEA kitchen. They didn't want to see people wafting around in white linen trousers. No offence to anybody in white linen trousers. But they wanted it to reflect their experience of their community. And they also wanted to challenge the myth that you can do too much of this. A lot of the parents we talked to were challenged by their own parents, by other parents, that you're ruining that child. Put that child down. That child needs, you're giving it too much attention. But they also judged themselves. They were looking at the parenting information online. They were comparing themselves to other parents. The red book, how big are they? What words do they have? All those things. I've done it myself. A long time ago, but I've done it myself. So we used that to develop a campaign, and I say, here's what the campaign's about. You can go on and look at our professional briefing on our NSPCC learning page, which I hope you're all following our weekly updates. It's free. And one of the things we did was we developed a leaflet, and although a leaflet in itself, we talk about literacy and accessibility, but sometimes what a leaflet can do is, in the hands of a professional, is say, this is an issue we can talk about, but I'm not judging you, and it's not me saying it to you. I'm using this as a tool to speak about a subject in a gentle way. I have some of the leaflets here. And we tested these out. We had 3 concepts that were brought forward. The 3 concepts, one was more brain development day, one was softer, and this was in between. And this is the one that we tested with audiences, went back out again. We tested and we developed these. So we developed the leaflet and also a flashcard, which I can tell you is disproportionately popular. Probably because it looks like a teething ring, and I'm sure it isn't health and safety approved, but I think that's what most babies were doing with it. And I've actually talked to NSPCC about making it into a teething ring, doing something like this with a teething ring, because the babies were able to handle it, it's tactile. It's also a prompt. We look around the COM-B model of behaviour change, capability, opportunity, motivation to change behaviour, and one of those things is to have those engaging, positive role models from your peers, and also to have visual prompts. So these things are like visual prompts. They're not going to solve everything, but they can help. We also had an email journey that over 700,000 parents have signed up to. It's age appropriate. You put in your child's date of birth, and I know earlier on we talked about not wanting to give details, which is perfectly fine. It won't suit everyone. But for some parents, it gave them confidence. They got tips every week and helped remind them about having heard about Look, Say, Sing, Play. We also have posters for childcare settings and various things. We made the flashcards downloadable. They do cost a bit to print, and we're not that rich an organisation as people think, 90% funded by donations. So we also talk to local authorities, if they want these, they can get it off us, print your own, do it yourselves. So professionals said, yes, we like them. It is a campaign, but we do want to use them in a more structured way. So we developed a programme with them. We tested it with them. So we gave them an outline of what you would do in a centre. Some centres ran off already doing it. Others wanted us to provide that, so we've also provided that, as well as posters to help prompt, again, the visual prompts about remembering to do this. So I'm going to play, hopefully, this. This is our original film.
How are you building your baby's brain? See what they're doing and join in.
Where's the blue fish?
Repeat the words and build their brain.
Oh.
Sing or hum. It doesn't matter how good you are.
You're happy and you know it, clap your hand.
Taking turns and having fun. You don't need special toys. Just play with what's inside. Every day and every night. You're building your baby's brain right from birth. Look, say, sing, play. Sign up for weekly tips and activities.
One-to-one visits. So it was going well, but we decided we were going to do a process evaluation. We got the Institute of Health visiting with Newcastle University to do that. And I'm going to go very briefly into this. Again, it's on the NSPCC learning site, you can search for it. So we wanted to ask, 2 years in, what were parents doing with the tips? Did they like them? Who were the audiences we were reaching? Who were we not? Because we know with any national campaign you roll out, and I work with local campaigns, I'll explain in a minute how we looked at that. So we also analysed, how did national campaigns, were they more effective, or was it a local campaign where we went in with our partners, many of you being here today, health visitors, local authorities, police, whoever wanted to work with us on a local campaign. And that's where we go into certain areas. So good news is 90% of the parents were saying that they felt it had changed their behaviour, or they agreed they were easy to use every day. 84% said they were certainly adapting their behaviour. And in a local campaign, we work with local authorities. So at the minute, we've just finished work with Merseyside Police under their crime reduction strategy. They came to us and they said, we want to use this because we've known around that evidence around getting in early with families and supporting them. We've then worked with other people around speech and language strategies, school readiness strategies, and for mental health strategies. When we create a local campaign, we go in with our partners, we invite them to join us. Sal would know this, but we kind of go in with an open door and as many people as we can bring on board. We also want to reach the communities who are not going to rock up and use either your or our services on their own, and we try and reach out to them. So that's where we've delivered it so far. Northern Ireland's missing, and we're about to embark on one on Northern Ireland. But the Institute of Health Visiting report also told us we weren't hitting enough dads, male carers, not surprising, even though we had a lot of male images in the original film. We weren't speaking to young parents enough, and we needed more accessibility and do more social media. We had also identified ourselves as devolved nations. Every time I went out in Northern Ireland and talked about, look, say, Sing, Play and brought that film, they said, we want to hear our voices. We need something that's recognisable for our communities. So we have a Welsh version, Scottish version, regional accents. We sort of challenged the NSPCC, even ourselves internally. Everything we do now, we say, make it regional, make it national to devolved nations. You have to put the effort in. And we also know that the pregnancy content needs built up. So I'm not going to play this one. So these are some of the new assets. And I'm just going to play, this is one of the new films we've just done for young parents.
1.
Right from birth, every time you look, say, sing and play together, when you see what they're doing and join in, you're not just bonding, you're building a brain and helping your child learn skills that will last a lifetime. From small moments come big things.
Carrie! It's still Mama!
Just remember, look, say, sing, play.
I suppose one of the things that also came out in the Institute of Health Visiting work was that parents were doing the saying and they were doing the playing, or no, they were doing the singing and they were doing the playing, but they weren't doing the saying so much and they weren't doing the look. They were still directing the gaze, they were still saying, look at that. And even in our original hero film, it drives me mad every time I see it, it's there, it's the parent is directing the child, and it's so hard to get people not to do that, but onto the serve and return. So we've tried to build that in. We have also created 3 languages we prioritise in terms of Urdu, Bengali and Mandarin. We're looking to do an Arabic film. We can't do all the languages at once, it costs a lot of money. We chose directors from that community. We chose directors who understood the language. We stripped out any cultural references, things like the hokey pokey, and there's these tips. And it's all based on a partnership with Room, which is the Bezos Foundation in America. They've over 1,000 tips, they have a free app. And we try to make that into a UK-wide appropriate set of tips. So we select the tips, we create our own assets around it. And I say it all tracks back to serve and return. So there's lots of things we've been doing with it. This is the young parents film, the other one was not as our new hero film.
I'm Abby and this is Leo, and he's 2.5 years old and we live just outside of Brighton. Leo absolutely loves cooking, especially if it's something messy to eat. Can you see anyone else with shopping bags?
Yeah.
Over there, how many has he got? Has he got 2?
Yeah.
How many do we have?
3.
We have 1, 2.
I'm Donna and this is my daughter Indy Rose.
And I'm Jamie Ray and this is Carter and he's 7 months old. We came into the Children's Centre today and there were these little flashcards saying look, say, sing and play. We tried a couple with the babies. Good boy.
They really enjoyed that.
Yay. You want to make some noise? Yeah, clever girl. My name is Chloe and I'm 24 years old and this is Amy Ross and she is just over a year old. She's just got an adorable little giggle. I picked up some of the look, say, sing, play flashcards at my local baby group. She had so much fun just with stuff that everybody's got in their kitchen. Clever girl! That was lots of noise.
There we go. Being a parent to a 2-year-old can be difficult sometimes. These little activities really help with just something for us to bond over and do. Hurry up. Mummy put them in the oven. There we go. Say bye. Bye.
Do you want to look in the mirror? These are them babies. I'm 22, so it's hard going out with a baby and people just staring at you.
If we get on the bus together, like, you know, like we've got each other.
Means a lot to us both, this friendship. Where's she gone?
When I was first taking Amy Ross out and about, I would feel a little bit self-conscious of singing to her and playing with her out and about, but now having these activities, it's really helped my confidence in that way and made me realise that I have nothing to be embarrassed about. Look, say, sing, play made me realise that little things can make a big difference.
And we have all our new additional work. So the first round of Look, Say, Play research more or less said this would work with families who had some challenges, but really for those with very, many challenges in their lives, it would be irrelevant. It would be something they wouldn't use or look at. But since it's been rolled out in the hands of expert professionals who are working with those families, they've come back and said, actually, no, we do want you to work with us. We want you to work in settings where children or these babies are on the edge of care, where we are in prisons, where we are doing other things. So we are now at the point of actually sort of revisiting that ourselves. And that was kind of, in terms of the sort of public health approach, we do it with everyone. We try and get it in at the midwife stage, at the health visitor stage, in the community centres, in the family centres, anyone working with a child. And I'd say the flashcards have the whole tip on one side and the brain building on the other, which is what I should have said very shortly ago. So we're now working in Bristol with a project called Project Mama, which is refugee, asylum seekers, modern day slavery survivors and others. And we're not going to use this content. They're going to help us create new content. The concept will be there, the ideas will be there, it will fit along the campaign. So we are not going to do a campaign that just sits still. We have to work with our communities. We did work with the Home Office very, very quickly around when the Afghanistan families came into the UK. They were desperate to get something to help address the very physical problems in the hotels. And we were a bit kind of, what we're doing, we're not going to even attempt to say it could make a dent in the trauma of what those families experienced. But they felt it would help their family support workers open up conversations around attachment, around newborn children in these hotel situations where there's no privacy, no space, just as you were talking earlier on, to build that, how do you do serve and return when you have 40 other people around talking and discussing. So we will do and we will try and adapt and work with anyone who wants to use the concept, and we're not precious about it. We co-brand, we co-create, and we always have to co-create with our communities. So this is what we're looking at the minute. We're working potentially in prisons as well, contact centres. We've new dads content, a whole new dads film. And we've done research with dads. They want things like a workbook. And they actually want to hear more about the brain science. The main cohort before said, no, don't put it front and centre. The brain. So no, dads are saying, no, we engage with that. But we'd like a workbook where we can tick off what we've done. We want it to be outside the home. We don't want it to be so home-based. So we have new content and new materials, as much as we can do. And we will continue to do that. And I'm not sure if anybody is waving at me. I can't see with my glasses aren't down. So it's my excuse. So to keep up to date with what we're doing, it's all online on the NSPCC Learning site. Contact myself, look on YouTube. We're here to work alongside everyone else. You are the experts in this area. we can hopefully bring it into communities that we work with. And I say, delighted to take any questions at the end or afterwards, and thank you.
So, thank you. I'm Alex, Programme Director for Better Start Bradford, and I'm going to talk about the two public health campaigns based on exactly the same thing as the NSPCC campaign, but how we've adapted those across the 5 Better Start sites for one of the programmes, and then more fundamentally into one of the Better Start Bradford projects. So the big little moments that matter, she says, hoping that it will. There we go. So big little moments, which was across the 5 sites, and was evaluated to really understand again how we translate the brain science messaging in a way that parents and the wider community can understand, so that again there's acceptance as to what we're doing and why we're doing it. And then that was then developed by our infant mental health service about actually demonstrating some of those everyday interactions. So Big Little Moments, was developed across the 5 A Better Start sites, and is about communicating that science into a way in which the public, that makes it accessible to the public, and most importantly that they understand the value behind it. There were 15 behaviours in total that were identified and concept tested, but that was kind of reduced down to 8. Really focused on how we can demonstrate to parents and carers those very small interactions, how they help their baby's development, and looking at ways in which we could kind of come up with creative ideas to demonstrate that, which ultimately came down to the families that were used as part of that testing, wanting both ethnically and gender neutral illustrated characters. So again, it's really interesting how you work with different families and they want different things. So here are the characters statically demonstrating the 8 behaviours. Again, very, very similar to what is expressed in the NSPCC campaign, just done in a different way. And I think, again, all of that is about some of the scaffolding of the messaging, and that we get messages out to our families and our communities in as many different ways as we possibly can. There were also a suite of animations developed for each behaviour, and then this should play...
Babies and toddlers are growing and learning every day. Look! Wow, is that me? And the little moments you share can make a big difference. From morning time to bedtime, waiting for the bus to playing together. Every moment is a chance to build a child's brain. All these little moments you share add up to something much bigger, giving children the skills they need to develop into healthy, bright adults. So find out how you can make the most of the big little moments.
So that's our overarching animation, and then there's individual ones for each of the behaviours. I've put the Better Start Bradford link, but on all of the ABS sites, the Big Little Moments campaign is referenced, as well as on NCB and on the lottery itself. In addition, again, it's that kind of layering of all the messaging. In addition to the animations, we also developed a number of other assets for the campaign. So posters, a booklet, which I had somewhere, very, very similar to the NSPCC one. Interesting you're saying about dads, because we do have a wall chart and stickers. Again, something that came up that parents wanted to be able to acknowledge when they had actually done the behaviours and that kind of that positive affirmation for themselves. We also developed flashcards, which were shared with professionals, again in a very, very similar way to yourselves, and then developed in their work with the families. And then little things like the fridge magnets and our little tote bags, which really just helped us when we're doing some of our more awareness raising of both the campaign, our service and our projects as a whole. Within Bradford, we also created some inflatables to be able to really help to bring some of what we were talking about to life. So again, because of our sensitivity around some of the language, they are literally known as Big Orange, which is a static blow-up character, and then Little Blue and Little Yellow. We absolutely came away, we were told categorically by the families not to call them monsters, because that has obviously a negative, so they're not, they are characters, and so they had those. But you can see that the smaller ones are on backpacks, so they literally go around. Obviously, for some children, that's really daunting, and it is all about the interaction of the human that is with them to be able to understand that. But in the majority, a real draw, particularly when we're doing kind of communication, community events, and then there are really good conversation started to then be talking about how those characters are modelling the behaviours. The campaign was evaluated. The campaign took place over 12 months and was evaluated, say, across the 5 sites. So we did a really heavy promotion using things like outdoor advertising, digital advertising, bus stops, buses, you name it. There were big little moments, posters, characters in as many places as possible across the 5 sites. And as you can see, we've continued to use the assets that were developed because they are good quality and are kind of spreading the messages that we wanted to. And again, similarly to the NSPCC campaign, our projects innovatively found ways in which they could use that content within their wider offer. So using things like the wall charts, attributing that to some of in some of our parenting programs. One of our nursery chains heard we had an advert on the local radio, heard that, and then kind of got in touch because felt it was a really good way of them being able to communicate some of the importance of why they do what they do in nursery and how that can be replicated at home and how parents would be able to do it. So it really worked on levels that we weren't expecting, and say parents really gave us locally positive feedback about how they found the messaging easy to understand and that they really liked having access to the materials and the characters, which they were then able to talk to the children about in different ways. So the evaluation looked, kind of did a before and after survey with parents, had focus groups, and also some telephone interviews with practitioners who were working with the families. And again, the results are there. From a campaign perspective, the numbers are actually quite positive. And we were able to demonstrate that the knowledge of the promoted behaviours had increased following the campaign. It was identified that it was most effective when used alongside wider parenting support. And I think, again, it's kind of that thing of just the campaign on its own, whilst certain things of it will resonate, actually, it's that scaffolding, it's the repeating of the messaging and making sure that the context is understood. But again, similarly to what Margaret said, what we really came away from is that the staff themselves said that having that resource and having that awareness then facilitated deeper conversations with the families that they were working with, enabled them to explore things that they possibly would have not been able to previously. And again, then there was a thinking of possibly we could have led to a greater behaviour change if it had focused more on how they could overcome some of the barriers to them. And I think, again, listening to where the NSPCC are going, there's some real opportunities for us to link all of this together. Equally, some of the numbers are really, really exciting. The materials were displayed over 13 million times just across 5 parts of England, and that in itself, that in itself is a lot of hits. And we actually had over 66,000 clicks onto the web pages. So again, that's much more than just the workforce within our own areas who we were directly directly targeting and saying then over 550,000 views of the videos. Again, all of our sites have quite a lot of different social media kind of platforms that we're using, and obviously looked at ways in which we could kind of maximise that. There's a link to the evaluation report should anybody want to really delve into, and certainly as an understanding of how a public health campaign such as this, then there are some really good kind of snippets within it, although it is quite long. And then building on about how that then helps us to develop our infant mental health focused piece. Again, looking at the same thing, but moving it on again, and also as a way, our Little Minds Matter is the Bradford infant mental health offer, and has developed as a service through our Better Start Bradford funding. But engagement is one of their strands, and when we were in lockdown, obviously opportunities to engage were significantly limited. So having a digital campaign was a way in which we could kind of build that part of their programme. They developed key messages with families themselves, but wanted to be able to take it another step forward. And so we worked together to develop the brief and involve parents and carers from the start. The parents really loved being part of that during lockdown. Again, the fact that they were contributing to something positively for their wider community and being given the opportunity to talk to other parents was something that was really, really valued. But as a result, we got really good focus on the task in hand. And what the parents told us, again, is quite similar to what you said yourself, was about, again, wanting something to be bright, positive, fun, really simple and accessible. You know, again, that kind of low/no cost. The accent thing's really interesting, and again, you may well have heard on the Big Little Moments animation that it's a northern accent, and actually Bradford had to pay extra to get a northern accent on the video. But it was something that our parents said that if it wasn't an accent that was familiar to them, that they wouldn't engage with it. And in the Little Minds Matter, they really said they wanted it to be real Bradford parents. They wanted it to be parent focused, and they wanted, again, the non-white linen trouser thing really comes across. It's also the fact that you talked about the judgment and needing to be non-judgmental. And they weren't always talking about judgment coming from professionals. It was from their peers. It was from their family. And it needed to come across in a way that didn't give any kind of judgment to what is right or wrong, just what you need to do. But that big thing about parenting isn't perfect or polished, and that needed to be reflected. So based on that, and our Big Little Moments evaluation, we developed videos. However, we couldn't use a film crew because we were in COVID-19 and there were massive restrictions. So the parents used their own digital technology to video themselves, which again really helped in terms of that being real and helping us to really show them how they could support us. And as a result, we developed 11 videos of the behaviours and then an overarching one. They have 3 main kind of messages that they are grouped in. Again, linked to the science, but really kind of focusing on encouraging and supporting parents to make the time for fun. And I think, again, the fact that this is a conference about play and how we've talked about how fundamental play is, that so much of parenting and so much about talking about development sounds like a bit of a chore. It sounds like it's something that you've got to work at. And it's saying, actually, it's the fun things. It is the taking the time out. And the fun things, those simple interactions, are contributing. You know, you don't have to be sitting marking things off on checklists, and you don't have to be working your way through a baby manual in order to be actually contributing to your baby's brain development. It really is the little moments that matter. So, confidently. So this is the overarching main campaign video.
Mummy, I love it when you do baby massage. It touches me, it makes me feel warm and safe.
I love it when we play peekaboo together and when you make me laugh.
Nana, I love it when we get the bubbles out and we can pop, pop, pop them. I love it when you blow raspberries on my belly. You sound really funny and I want to copy you.
I love it when you read to me. Hearing your voice really makes me so excited to meet you. That's how I feel about you.
Daddy, I love it when we play games together. Your games really are the best. Mummy, I love it when we rub noses together. Your nose against mine makes me giggle out loud.
So why not take time each day to have a moment that matters with your little one? For more inspiration and ideas of what you can do at home with your little one to help fun, to feel connected, help with their brain development, please visit momentsthatmatterbradford.org.
And then, so they kind of talk about where to go for the resources, but then each of the behaviours is listed there, and obviously talks a little bit more about kind of the brain science behind it, but is really focused on the demonstrating the behaviour. One of the things about the area that we are working in is that we have a high proportion, a significant, well, over 50% of our women who are born outside the UK. So some of the things that we're listing here are not necessarily things that they have experienced themselves or are part of their own kind of cultural experience. And we also have a third of the women having babies have either very poor or no English. So again, the need to be able to actually have resources where things are being demonstrated. Yes, there is language overlaid, but we have over 50 languages spoken within the Better Start area, which is only 3 wards of Bradford. So us really then kind of focusing in on language was something that was determined not to be helpful, and that actually just having the way of being able to show it worked an awful lot better for our families. So again, we've used a wide range of different kind of social media images and adverts throughout the campaign itself, which was launched during Infant Mental Health Week, and then continues to be used. We also use it in things like training, again for the workforce themselves, and again that these videos are resources that are then available to them to either use directly with families or for their own training. We haven't been able to do the same level of evaluation of that as obviously happened within, but we do have that we've had really positive feedback about seeing real Bradford families represented, and actually that they were part of it. And like I say, we kind of continue to be able to use the suite of resources. I have rattled through a little bit, but hopefully there is a little bit of time for questions for both of us.